Well, welcome to Women on Wealth. I'm your host, Julina Ogilvie, and today we're diving into a topic that touches so many families, often in an unexpected and challenging way, which is really dementia care. And I'm thrilled to be joined by Neil Anand, who is the owner of ComForCare Home Care in Fairfield, Connecticut. They are a premier provider of in-home care, helping older adults live independently in their own homes and continue to do all of the things that they love. The home care company is committed to helping people live their best life possible and also offers special programs for people with Alzheimer's disease and other forms of dementia. So, Neil, welcome.
Thank you. Thanks for having me, Julina.
Oh, no, I know you're going to have a ton of information for us today. And before we get into it, I know you also have your own story of why you created the business, and I would love to have you share it.
Sure. Yeah, I think we're going on a little over 7 years now. And as far as kind of my story and opening Comfort Care, a lot of it really was more along the lines back in the day of, at some point in my life, growing up around a lot of entrepreneurs in my family, wanting to do something on my own. I wasn't sure what that would be or what exactly that would look like. So a while back, really started looking at a lot of different concepts and industries and ultimately always seem to kind of gravitate back towards the overall healthcare space. I think a lot of that was probably just my upbringing, growing up with two parents as primary care physicians, and seeing everything that's involved in terms of caring and helping for people. And my father taking me to the hospital, make rounds to see patients, and maybe go out to lunch afterwards, and just kind of seeing that hands-on, as well as how they ran their medical practice. So this is definitely different. I
Yeah.
didn't really go the route of becoming a physician, but there was, I think, something about growing up around in that space that gravitated me back towards this industry. It is also, one of the fastest growing industries with the aging population. So it's certainly a good business to be in, but at the same time, I found it to be, I think, more than anything, just extremely fulfilling and rewarding when you see the impact you can make on the lives of others and their families.
Yeah, I can only imagine. So thank you. Thank you for sharing that. And it's amazing how many experiences we all have that come from such an early age. So it's just another example of entrepreneurs, creating their business, starting their business because of their upbringing. So that's great. So let's start with the basics. What exactly is DementiaWise and how did this initiative come about?
A lot of it, I think, is just related to the reality that we are facing, in America, but also globally. So these are some figures from the Alzheimer's Association. Over 7 million Americans are living with Alzheimer's disease, and dementia is an umbrella term for different types of cognitive impairment. Alzheimer's is the one probably most known. It's probably about 70% of all dementia, so that's one way of looking at it. And of that 7 million, this figure is expected to double by 2050. So not even that long from now.
Yeah.
1 in 3 seniors dies with Alzheimer's or another form of dementia. And that is killing more people than breast cancer and prostate cancer combined currently.
Wow.
So we always say, when there is no cure, there's care. So DementiaWise is our proprietary care enhancement program developed throughout many years, providing training and education. Every employee here does go through this. And then we also like to, in the community, provide family members, with similar training and education around our curriculum. DementiaWise is one of only 3 outside programs recognized by the Alzheimer's Association. And a lot of it is because it incorporates evidence-based dementia care practice recommendations, focusing on person-centered care, assessment and care planning, focusing on continuing to bring out activities of daily living, behaviors, and communication. When we do some of these events in the community, the curriculum focuses on 5 key principles, and that is focused on feelings, mind emotional displays, respect personal preferences, make the care person centered, and improve your own communication skills as a caregiver, whether you're a professional or a family caregiver. So
Mm.
it's, as those who might be dealing with a loved one who's going through this, sometimes there can be very challenging days, and there can be, potentially some challenging behavior. So our principles are all about reducing challenging behavior before it starts and practical techniques for caregivers to create better days, both for the person providing the care, because it does take quite a toll on them, and for the actual person with dementia.
The statistics are staggering. I'm sure most listeners either have had an experience or unfortunately are going to have an experience going forward. So, and Neil, how long has the program been around?
So it's been around over a decade. So ComForCare is part of a national franchise, and so I am one of the locations here in Fairfield County, Connecticut. So the curriculum has been developed for quite some time, even actually before I started this location. And every year, we continue to evolve it as we learn more about the
Yeah,
disease. We are about to roll out a DementiaWise 2.0, and we hope to bring a lot of that new education into the community over the coming year.
that's great. And I know DementiaWise is part of a broader Medicare initiative. Can you walk us through what that means and how it differs from standard dementia care and the support there?
So DementiaWise actually it's separate from anything that Medicare potentially is providing, but it all kind of comes together. So we're not directly related to this new initiative. I think what you're referring to is a brand new initiative that just started this year from Medicare, that the government is committed, at least 8 years to this program. And personally, I think, once they see the data and the results, they'll want to extend this. It's
Got it.
called it's and in my experience in all these years, Medicare does not cover these types of services, home care. You're either paying privately out of pocket, or you might have long-term care insurance, some other resources. But generally speaking, this is not something that was ever covered through Medicare.
Got
Uh,
it.
they started this new program they're piloting called Guide, Guide, and it's guiding an improved dementia experience.
Mm,
And it comes with a lot of features if you qualified specifically for those who have a dementia diagnosis. And it can get you 24/7 support via this hotline, care coordination. Where we fit in is that you can be eligible for up to $2,500 a year, fully covered through Medicare towards the cost of these types of services, the home care
mm,
services. And a lot of it was put into place to give respite care to family members, to unpaid caregivers who are, bearing the burden. And what they'd like to see, which I think they will, is reduce hospitalizations and less family caregiver burnout, because now, you can use these funds to get some outside help. And that could be maybe that you want to go away for a short period of time, or there might be periods of the day that you could use someone professional to come in from an agency and help take care of a loved one, so that you yourself can get a break or do what you need to do. The great thing about it, my experience so far, is that families can use the funds however they want throughout the year, whether it's all at once or spreading it out on some sort of schedule. So
mm.
there's quite a bit of flexibility. It's just a matter of knowing about it, and from there, we'll guide you through the process in terms of qualifying. Overall, the qualifiers really are that you have to have Medicare. So first of all, you have to have a dementia diagnosis. Um, you have to have Medicare A and B, but cannot have Medicare Advantage. And you can't be in a long-term nursing home, but you can be in your own home. You can be in assisted living. That's all fine. And the only other disqualifier would be that you cannot be on hospice, but this potentially could be a bridge to getting some help and some care if maybe that is what you are deciding down the line. But other than that, I found it to be a program that's very easy to work with to get people the help that they need. And like I said, there's quite a bit of flexibility in how you can use those dollars throughout the year.
Thank you for clarifying that. It's just an example of why families need guidance from someone like you. There's just so many moving parts and so many options, right? That I'm sure a lot of individuals aren't familiar with. Can you talk a little bit more about the care coordination and management and what that looks like in practice for families and caregivers?
Sure. So a lot of it is working with, everybody who's involved in the person's care, so including physicians and anybody else who's, trying to coordinate. So Guide, for example, has a 24/7 care management and call support line. We will help develop personalized care plans. So we understand that there's different stages of dementia,
Mhm.
early, mid, late stage, and how you interact and care for somebody really varies in terms of what stage they're in,
Yeah.
the extent to which you might be able to give someone more choice, whereas in the later stages, that's going to be tougher for them to necessarily process between. But as much as possible, what we talked about earlier, person-centered care, we want the client, the patient to feel, as still, involved and as independent as possible. So we that is part of the kind of the care coordination to really make care personalized, person-centered, and it also will be a liaison between any of their other providers and other family support they might have as well.
Okay, that's great. And I know the education and the support is a whole other component of this. What kind of resources training does DementiaWise offer to help caregivers feel more confident and maybe less isolated?
Mhm. So a lot of it is we do bring in outside resources such as like the Alzheimer's Association, medical professionals, town social services, uh, and a lot of that is to also understand what support groups might be out there, so that you know that you're not alone and what might be available locally to you. And a lot of it really is about learning from each other's experiences. And the actual DementiaWise program is very interactive, a lot of examples, video examples of situations that families might be in and how someone else might have dealt with it, which I think could be very helpful to someone else who might be going through the same thing.
Yeah, support group. That's what we all need, right?
Yeah.
And it can also affect everyone a little bit differently. And so, how does this initiative personalize the planning that reflects the unique needs of each individual and family?
Right. So a lot of it are these are techniques. So it does affect everyone differently. I think some of the similarities are that a lot of times people are not sure about how to deal with when the challenging behavior arises,
Mm.
and the techniques keep your family and your loved one calm, happy, and engaged, caring for someone. So that depending on where they are as far as their diagnosis, you know what the right plan would be and how you would want to interact and structure your day to day. Some of the examples are verbal versus nonverbal, depending on the stage you might be in. In the earlier stages, I think I mentioned about giving choices.
Mhm.
There's an exercise we go through where in the earlier stages you could be, in the grocery store, uh, deciding what to get and whether it's red or green apples. In the earlier stage, you can give someone a choice because they're still able to potentially process that. As they get into later stages, you could potentially still give two choices, but if you want them to pick the choice you want, then you probably would make that the second choice because it's the one they are going to remember. They probably would have already forgotten the first choice. And then towards the later stages, when someone might even become nonverbal, you have to go back and think to, if you've been caring for someone for a while, what you do anticipate their preferences being. And there you won't necessarily be able to give much of a choice, but you will remember, from the past what their preferences are. And it's very important to respect that because even somebody who might be nonverbal at that point can still retain emotions and and feelings and all of that.
Wow. And what about respite care? It's critical, it's often overlooked. And what role does it play in the initiative?
That was really one of the main reasons, from what I understand, that guide came about.
Okay.
It was to, so for example, when we're, when we have to find out if someone's qualifying, and then we have to do kind of a mini assessment on it, we need to identify who the primary family, it doesn't have to be family, but primary caregiver is, who's the unpaid caregiver. It could be a spouse or a daughter, and that person needs to be a point of contact if there's any questions, or we ask questions of them as well. in terms of how they're feeling about managing this and what resources they need. So it is really all about respite to give the unpaid family caregiver some relief by getting outside help, and that's where those funds come in.
Okay, great. And I guess speaking of families, what would you say are the biggest misconceptions that families have when it comes to managing dementia at home?
The biggest misconception is probably just that it cannot be managed at home,
Okay.
and there might be a point depending on resources and who how much the family is available to help out. But generally speaking, with the right support, resources, and techniques, sometimes the home is the best setting to age in place because it's familiar, and it'll still be familiar for someone with dementia because the long-term memory is still preserved for quite some time.
Mm.
And as long as I think things are set up properly, someone can really live a nice, meaningful life, in the home they might have been living in for decades. Obviously, we understand that, that might not always be the case, and we're happy to make recommendations to community-based living, people that we know in the community that can assist with that.
Okay. And Neil, I know you have a ton of stories and experiences, but is there one that possibly resonates with you that you've seen the impact that it's created for the family?
Yeah, so a lot of it in terms of how we approach it is to really understand who this person was. We do a social history intake, with the help of family members to kind of go back in time and who were they? What did they do? What did they used to like to do? What maybe do they still like to do and can do it, but they need assistance in order to do it? It's all about meaningful activities. I can certainly think of a lot of examples. One lady in particular who before coming in, was feeling very isolated with very minimal social interaction. And a lot of it was because friends and family members didn't want to spend as much time with her because they didn't know how to handle her in terms of when the challenging behavior would come about, or when she was being very forgetful about things, and they felt that it was an added burden of worrying and caring for her versus actually spending some quality time.
Mm.
But by getting some in-home care, professional caregivers who've been able to step in and help facilitate meaningful activities. So, for example, they can just focus when they get together. They can just focus on being friends or just on being a daughter versus worrying about the day-to-day
Mhm.
tasks and the care and making sure she is getting bathed and eating and dressing. And now her friends can visit her, and the aide is taking care of everything where they can just go enjoy a lunch, whether it's out or prepare a lunch for them at home. And they
Mm.
don't have to worry about all the other stuff. It's really about spending quality time together. So that was certainly one example, where she was feeling very isolated. And now we're on like a very nice plan, really a social calendar week to week where we're making sure there's things to do
Yeah,
while also providing the support and the care that's needed and the safety supervision in order to make that happen.
that's great. That customization, right?
For sure. Yeah.
Yeah. And how do families or caregivers find out if they're eligible for guide?
So you can contact us, for example. The criteria, I think I told you about having A and B, and all of that. That's really at like a high level, but we can very quickly check eligibility. They've made it pretty easy in this online system where we just need some basic information about about the client, name, date of birth, Medicare number, one or two other small things, and we can very quickly, within the same day, get a pre-qualifier, whether someone qualifies or not, and then from there we'll move forward and just finish all the other steps. And it takes about a few weeks from start to finish. I'm assuming that'll continue to speed up as this program grows. But in my experience, it's easy to work with, and a lot of transparency throughout the process to make sure that you're going to be covered and that you qualify.
That's great. And
And obviously, if you want to just in general learn more about this, you can Google Medicare guide or CMS guide, and there's a lot of technical information on there. But at a high level, that's what you would need in order to qualify. And like I said, we'll look into that for you very easily, so that you have a quick yes or no, and then we can go from there.
And Neil, you must come across this a lot. Families or loved ones that can't quite admit or don't quite acknowledge the forms of dementia. So can you walk through maybe some of those signs?
Sure. Yeah, a lot of times it's thinking about, well, is this dementia, or is this just typical, getting older, age-related forgetfulness, and
Mhm.
everyone forgets things from time to time.
Oh yeah.
Um, Kind of looking at an overall list here. Some of the more typical age-related changes could be making a bad decision once in a while, whereas dementia, you're starting to see consistent poor judgment and decision making, and a lot of times this could be um, financial errors or potentially even getting scammed. Typical forgetfulness could be like you're missing a monthly payment, whereas with dementia, you have inability to even manage a budget anymore.
Mm.
Someone else has to manage your finances. Or, like I said, you might make some bad decisions, forgetting which day it is, and then, remembering it a little bit later. That is probably more about age related forgetfulness versus completely losing track of the date or the season.
Mm.
And some of the assessments that they do, ask you those things like, do you know what actual day it is and what season it is? And sometimes the other end of it is you're just forgetting maybe which word to use, or you're trying to articulate something. Whereas with dementia, you just have difficulty carrying a conversation altogether.
Mm.
So those are some of the differences. Losing things from time to time, finding them later, versus completely misplacing things, and being unable to retrace the steps of where it could have been to go find it. Now that's going to be more along the lines of there might be signs of dementia. So those are some of the
Okay.
distinguishers between a little bit here and there versus noticing consistent patterns.
Mm.
And anybody after a certain age, as part of your physical and your checkup, should always ask for one of those mini mental cognitive assessments. It should just be part of your physical and your checkup,
Mm.
and shouldn't be afraid to ask for that, and that'll help you manage it throughout the journey.
Yeah, that's great. And I'm sure a lot of us are hit those signs of age memory, and it's so thank you for clarifying that. As I couldn't find my keys this morning. And what about advice that you would give for the listeners that are showing signs? What are the first initial steps?
Definitely don't be afraid to start thinking about it and addressing it. It's possible it might not be anything. A lot of times it could be something like vitamin B12 deficiency. It's not always necessarily that, but you do want to make an appointment with your primary care physician, and like I said, ask for an evaluation.
Mhm.
Start making that part of your checkups. And if they are noticing something, then you should ask for a referral to see either a neuropsychologist or a geriatric psychiatrist or a neurologist, so that they can look into that further. I think primary care physicians are great, having grown up with two, but sometimes when you reach a certain age, having a physician who specifically specializes in geriatrics can be beneficial, especially if you're noticing things like this.
Yeah,
And like I said, just keep regular with your checkups and start making this part of that.
that's great. Thank you, Neil. And anything else that's sort of top of mind for you that I haven't asked yet about this that you might want to mention?
Just to know that there are other resources out there beyond this, and one of the areas you might want to look into if you're still working is if your employer offers any benefits as it relates to backup care. They're usually part of an EAP, employee assistance program, and it might be part of your just overall HR package and your benefits package. And I've worked with numerous companies now who might give X number of days in a year, fully covered, the cost of it fully covered by your company, to get you some care at home, whether it's for an elderly parent, your child, even maybe yourself if you're recovering from an injury or an accident or
Mm.
a surgery. And a lot of people don't know about it, but you might want to check with the company that you're working for if they have anything like that in place, because a lot of the mid to bigger size companies do, in my experience. And that can be in addition to this. So I always say let's look at as many options as possible, and you
Yeah.
can certainly mix and match and tap into various resources, not just one.
Yeah, no, I think it's a great example of there are several options out there, but being able to understand and maneuver and then create a plan that's customized for you or your loved one is what's key. So I appreciate you saying that. Neil, I appreciate what you do. Thank you. And I know you have always been available if people have any questions. What's the best way for people to reach out to you?
You can call us. We're at 203-612-8966. And so you can call the office anytime. We'll get back to you. And you can also check out our website, comforcare.com, ComForCare.com/Fairfield CT. And there's a wealth of information there, including more on the DementiaWise program and other education. And there's also a form on there. If you have questions or inquiries, you can fill that out as well, and we'll make sure to get back to you.
That's great, Neil. And I know you mentioned, but you're a national franchise. So if people are not in Connecticut, there are plenty of other options across the country.
Correct. Just need to know your zip code, and more likely than not, we should have a presence somewhere else in order to help you, and we'll help you make that connection.
That's great. Neil, thank you as always for your insight. We appreciate it.
Thanks so much. Thanks for having me.